So I'm very fired up about this panel. It is about the future. And so what everybody is going to do is talk about what their vision is of baking in health literacy to clinical trials, practical strategies, the when and how of involving stakeholders. And one of the things I learned this morning, it's not just stakeholders from the investigator perspective, but what about the patient perspective of who all the players involved are, and then studies that they would like to see in the future. The cool thing about all these women, we're all woman panel here, is their diverse interests, roles, experiences in clinical trial research, and they all get health literacy and see it as an integral part of medical studies. Our television prep call, you all, was very stimulating for me. They're very knowledgeable and impassioned about what they're doing, and it was great because I like to learn stuff, and I learned a lot on our phone call. So I'm very eager to learn some more in the next hour. And so here's the 90-minute instructions. So they're each going to have 5 minutes at the podium. Then we're going to have a discussion, and then at 4, we'll break it open to all of y'all. So I want to start with Emma, and let me introduce all of them. Emma is world traveler, world worker, and she is Senior Director at Pfizer U.S. and Global Medical Affairs Women's Health with a focus on Pfizer's menopause portfolio. She has extensive experience in medical communication and building stakeholder partnerships all over the world, particularly in Latin America. She's a pharmacist who was born in Uganda, and she speaks 3 languages, Luganda, is that how you pronounce it? Luganda, French, and English. So she's well-versed in both health literacy and cultural competence. And then next is Monica Mitra, and she is the Nancy Lurie Marks Associate Professor of Disability Policy and the Director of the Lurie Institute of Disability Policy at Brandeis. Her research examines healthcare experiences and health outcomes of people with disabilities. And Monica, until our phone call, I had just forgotten people with disabilities as a part of clinical trials. So thank you for raising my consciousness. Her current research focuses on health needs and barriers to perinatal care among women with disabilities, including women with intellectual and developmental disabilities, the deaf, and hard of hearing. She currently co-leads the National Research Center for Parents with Disabilities and the Community Living Policy Center. She's a member of the Disability and Health Literacy Journal editorial board and the Academy of Health Disability Research Interest Group. Giovanni, are you next? Giovanni Spinner leads the outreach and communication team in the Office of Minority Health of the Food and Drug Administration. She oversees strategic direction of the team, advises senior officials on minority health, and leads the Diversity in Clinical Trials initiative. She works to improve health equity across the lifespan through research, communication, multi-sectoral partnerships, and leadership coaching. Before joining the FDA, she managed the National Community Health Worker Initiative, the National Community Health Worker Health Disparities Initiative, which aimed at reducing cardiovascular disease and asthma health disparities through community education. She also provided health policy guidance for the National Vaccine Program Office and served as Virginia's Director of Vaccine Safety for Children program. Dr. Becky Williams is Acting Director of ClinicalTrials.gov at the National Center for Biotechnology Information of the National Library of Medicine of the National Institutes of Health. That's a lot of ofs. And before that, she's not new to this acting position. She was assistant for 10 years. She's responsible for technical, scientific, policy, regulatory, and outreach activities related to the operation of ClinicalTrials.gov, which is an international registry and results database of clinical research. Her research interests include improving quality of reporting of clinical research, Previously, she was regulatory affairs consultant and had supervisory roles at the FDA in the area of prescription drug advertising and promotion. So Emma, let's start with you. I'm eager to hear what you have to say and learn some stuff from you.